क्योंकि प्राइमरी हेल्थ केयर से ही हम लोग जो हैं वो स्वस्थ हो सकते हैं, कॉस्ट इफेक्टिव होगा। बीमारी बढ़ जाती है जैसे कैंसर है, तो ये इन सब सारी चीजों की चर्चा हम लोग करेंगे। लेकिन एक ऐसी बीमारी है जो बड़ा रेयर है, वो उसके बारे में लोगों को पता ही नहीं है, और बीमारी है, अब पता नहीं वो बीमारी क्या होती है, कितने तरह की होती है। और आज WHO डे के लेकर हम लोग चर्चा कर रहे हैं, तो किस तरह से पहचानेंगे उस बीमारी का, क्योंकि पहचान ही नहीं है तो इलाज कहाँ से होगा, और घर परिवार पीड़ित होता है। और प्रोफेसर डॉक्टर रमैया मुथियाला साहब तो अभी इंडिया में, अभी अमेरिका से जुड़े हैं, हम लोगों के मुख्य अतिथि हैं, लेकिन वो इंडिया में कई जगह काफी बिजी थे, वहां उन्होंने कुछ रिसर्च किया है। प्रोफेसर डायरेक्टर एट यूनिवर्सिटी ऑफ मिनेसोटा USA, एंड प्रेसिडेंट एंड CEO इंडियन ऑर्गेनाइजेशन फॉर रेयर डिजीजेज। सर, ये रेयर डिजीजेज जानना जो है ना बहुत जरूरी है, क्योंकि तभी तो इलाज होगा कि वो बीमारी होती क्या है। प्रोफेसर डॉक्टर रमैया मुथियाला जी फ्रॉम अमेरिका, स्वागत है सर RJS PBH के 342वें संस्करण में।
ओके, थैंक यू वेरी मच मन्ना जी। मुझे माफ करना, मैं हिंदी में नहीं बोल सकते हैं, तो आई ट्राई टू स्पीक इन हिंदी, सॉरी इन इंग्लिश।
बाइलिंगुअल प्रोग्राम है सर।
ठीक है, थैंक यू very much for giving this opportunity. As you know, that today is the April 7th, World Rare Disease Day. As you know, it was established in 1948 by the World Health Organization, right? This day actually emphasizes the need to tackle urgent health concerns and advocate for policy changes to enhance the health outcomes. For many reasons, right to health of millions of people is increasingly threatened worldwide. Therefore, the campaign for World Health Day will urge government worldwide to intensify efforts to end preventable deaths and many other unhealthy causes. As you know, women are generally blamed when a newborn baby has an incurable health condition. Stigma goes everywhere, unfortunately. Tragically, based on current published estimates, 300 million people are born genetically different worldwide. Among them, 60% people are children who do not see their fifth birthday. These conditions are often chronic, progressive, disabling, and frequently life-threatening. Most have no cure, as you might know, and many are not even currently diagnosed. In India, there are fewer patients per disease. Collectively, the rare conditions population is about 90 million, suffering from more than 7,000 rare diseases. Approximately 1/3 of the world rare disease population is expected to live in India. Can you believe that? You will see in a minute. It is not. Sorry. Is not just
okay.
India's. Okay. Sorry if I get disturbed. Being genetic, these conditions are no longer localized, but instead go all over the world due to mass migration, famine, conflicts, and opportunities for better life elsewhere. It is a worldwide problem, not just in any one country. Therefore, this is a timely topic to discuss on the observance of World Health Day. Here I present the rare disease momentum, where it started, where it is going, and how each country individually and collectively is taking the problem. It is important to note that patient organizations and NGOs have taken all the initiatives so far. Starting from India, the patient voices have brought all the progress you are about to hear from me. First, in 2005, we started an NGO, the Indian Organization for Rare Diseases, dedicated to serving the rare disease population in India. Its mission is to raise awareness, advocate public policy, promote diagnosis and treatment, and improve social structure. Its vision is that all rare disease patients should have equal opportunities to those with common disease. It collaboratively works with patients and their families, patient organizations, state and certain governments, research institutes, pharma and biotech companies, and many other stakeholders. With their efforts, now the phrase rare disease no longer foreign to most Indian people. We are proud of that. They we helped the draft the national health policy for rare diseases, amendments for clinical trials, the inclusion of PLI schemes, and received eligibility for CSR funds, and so on and so forth. Now, let's now move to the rest of the world. A lot is happening throughout the world. I've tried to brief very few of them. First, we go back as far as the 1980s. The state of the rare diseases in USA is almost the same as today in India. In the 1980s, families, advocates, and leaders of the several rare disease patients organizations formed an ad hoc coalition to focus attention on this problem. The coalition was instrumental in passing the Orphan Drug Act of 1983, a landmark bill that created financial incentives for developing treatments for rare diseases. Later, it became a national organization for rare diseases, for short NORD. Since the foundation in 1983, NORD has been a vital voice for patients and families, advancing the research, advocacy, education, and patient support for these affected by rare diseases. NORD works with Congress, federal agencies, and state governments to influence policies that benefit the rare disease community. Several remarkable services NORD provides by working closely with over 300 member patient organizations, including the US Food and Drug Administration, National Institute of Health, biotech and pharmaceutical partners, and global organizations like Rare Disease International. Since the passage of Orphan Drug Act 1983, US Food and Drug Administration has approved more than 880 orphan products and rare disease therapies. This is a beacon of hope for the over 30 million Americans and 300 million worldwide living with rare and with more than 10,000 plus known rare diseases. Over 90% of 5% of them still don't have any approved treatments. Now let's move on to the US to the Europe. The European Organization for Rare Diseases, or EURORDIS, is a non-profit alliance leading rare disease advocacy across Europe and globally. EURORDIS brings together over 1,000 patient organizations from 74 countries, representing people affected by more than 2,000 rare diseases. EURORDIS is a central voice in shaping Europe health policy. It collaborates with the European Commission, European Medicines Agency, and national governments to improve access to orphan drugs, harmonize size, rare disease strategies across European Union countries, and strengthen the national disease plans. While EURORDIS is rooted in Europe, its impact is global. As a founding member of the Rare Disease International and co-founder of NGO Committee for Rare Diseases, EURORDIS extends its advocacy to the United Nations and worldwide organization, the WHO, helping shape rare disease policy on a global scale. We will talk more about these things in a minute. First, NGO Committee for Rare Diseases. Now, let me talk about this NGO Committee for Rare Diseases. The NGO Committee for Rare Disease is a substantive committee of Congo. Congo means the conference NGOs in consultative relationship with the United Nations. It is the key player in international movement to elevate rare diseases as global public health, social, and human rights priority. Established in 2015, this committee brings together civil society organizations, patient groups, medical experts, and policymakers to advance rare diseases advocacy globally, especially within the United Nations framework. The committee mission is to promote recognizing the rare disease as a global priority in health, social, and human rights agencies, and to foster international cooperation and knowledge sharing among civil society organizations, to advocate for including rare diseases in the 2030 Agenda for Sustainable Development Goals of United Nations, to engage directly with United agencies such as World Health Organizations, UNESCO, UNICEF, UNDSA, and many more. The committee has been instrumental in organizing high-level events at the United Nations. I was fortunate to attend a couple of these meetings. These events bring patient voices directly to globally political discussions and encourage governments and international agencies to take necessary action. It also played a key advocate role in the historical adoption of the first UN resolution in 2021 at UN General Assembly 24 on the quote, addressing the challenges of persons living with rare diseases and their families. This was the landmark movement signifying international recognition of the struggles of the millions of people living with rare diseases. Now let's talk about another NGO, Rare Disease International, RDI, is a leading global alliance dedicated to advancing for the rights and well-beings of all over 300 million people worldwide with rare diseases. Founded in 2015, RDI unites patient organizations worldwide, working across borders and diseases to ensure that no one is left behind due to rarity of their condition. RDI was created to provide a unified global voice for people with rare diseases and bring their needs to the forefront of the international health and policy agents. Its mission involves around three key objectives. Rare Disease International represents rare diseases patients and families internationally, especially within the organizations such as WHO, UN, advocates for policies that ensure universal health coverage, social inclusion, human rights, and equity for rare diseases communities. Again, in 21, rare disease played a vital role in advocating for the adoption of the first ever UN resolution on rare disease, officially recognizing the global challenges faced by persons living with rare diseases and emphasizes the need for their social and economic inclusion. Through campaigning like Rare Disease Day and collaborations with the regional alliances and NGOs, RDI helps raise global awareness about unique challenges faced by those with rare diseases. It also promotes the inclusion of rare diseases in global health system and development goals such as UN Sustainable Development Goals. RDI has made many contributions. It has advocated for rare diseases as an international public health priority. Notable milestones include co-organizing a policy event at the United Nations in 2019, joining the civil society engagement mechanisms of universal health care, and contributing to including rare diseases in the UN Political Declaration of on universal health coverage. Now let's go to WHO. As you know, the World Health Organization is the leading global authority on public health. It plays a critical role in addressing the complex and often overlooked challenges that people with rare disease face. Historically, rare diseases have not received proportional attention in global health discussions. However, the WHO has increasingly acknowledged that health equity cannot be achieved without addressing the needs of these with rare conditions. The WHO supports rare disease advocacy through many, for example, policy guidance to integrate rare disease in the national health plans and universal health coverage strategies. Further, capacity building. It is needed in countries to impoverish diagnosis, surveillance, and treatment and infrastructures. It emphasizes the importance of data collection and research collaborations in understanding the rare conditions. Rare diseases are increasingly being recognized within the framework of universal health coverage, which aims to ensure that all individuals have access to health services they need without financial hardship. The WHO emphasizes that people with rare disease must not be left behind in this effort. World Health Organization International Classification of Disease, which is generally known as ICD codes. These include a new, more comprehensive coding system for the rare diseases. For example, the ICD-11 identifies approximately 5,500 rare diseases, providing unique identification for documentation and research. This classification helps improve the understanding and management of rare disease globally. Now let's go to the United Nations. We started just for India. Now we are at the United Nations, what they are doing for us. Rare diseases and the challenges of persons living with rare diseases are progressively becoming a policy priorities at the United Nations. The United Nations has acknowledged that rare diseases are not just medical issues, but also social, economic, and human rights concerns. People living with rare disease frequently face delayed diagnosis, limited treatment options, and system barrier to care and inclusion. These challenges are even more acute in low and middle income countries. The United has linked rare disease advocacy to the Universal Declaration of Human Rights and to the 2030 Agenda for Sustainable Development. The UN General Assembly adopted its first ever resolution on rare diseases, entitled, I quote, Addressing the Challenges of Persons Living with Rare Diseases and Their Families, unquote. The resolution emphasizes the importance of promoting and protecting the human rights. It also aligns with the UN 2030 Agenda for Sustainable Development, advocating for universal health coverage and enabling access to resources for those with rare diseases. The UN works closely with the Rare Disease International, EURORDIS, NORD, all these things I just spoken to you. As mentioned above, these groups amplify patients' voices and work to influence policy at the international level. We have already discussed all these things above. Let me conclude my presentation with an announcement of the existing upcoming event to make rare disease as a global health priority. The Arab Republic of Egypt and Spain have put forward a historic World Health Assembly resolution co-sponsored by 24 other member states, 245 organizations, including patient associations, research centers, and healthcare institutions, urging the revolution of rare diseases, a global health priority for Equity and Inclusion, a draft global action plan at 78th World Health Assembly on May 21st, 25 to adapt. I hope to attend this event. Momentum actually continues in support of the resolution to go behind the World Health Assembly. Resolution calling for global action plan on rare disease with over 240 civil society organizations, including patient associations, research centers, and healthcare institutions joining the coalition. The coalition emphasizes the importance of this resolution in advancing equity and inclusive, aligning closer with the principles of universal health coverage. We are optimistic that the resolution will pass unanimously. Therefore, there is a good chance that rare disease issues will come to the forefront globally. Therefore, we move from a healthy beginning to a hopeful future. With a reminder with this respect, I quote, health is a blessing in one's life that only the sick person can see. I express my appreciation to RJS PBS for providing me this opportunity. Thank you for listening to you. Thank you.
थैंक यू टू यू सर। हेल्दी बिगिनिंग्स होपफुल फ्यूचर्स पे रेयर डिजीज जो है बच्चों को जो हो जाता है, काफ़ी मैंने सुना है कि बहुत महंगी दवाइयाँ आती हैं, लेकिन आपने 2005 में ही इस विषय को लेकर भारत के लिए आपने NORD बनाया, IORD, इंडियन ऑर्गेनाइजेशन फॉर रेयर डिजीजेज। और भारत और अमेरिका में एक ही तरह की ये बीमारियां इस तरह से बच्चों में ज़्यादा होती हैं, और आज बच्चों को लेकर ही चर्चा की जा रही है, जच्चा बच्चा कैसे स्वस्थ रहें आगे। और WHO ने तो साल भर के लिए इसको कैंपेन के रूप में लिया है।